Okay, this recording is going to be over Alzheimer's, Parkinson's, and Huntington's disease. Alzheimer's disease is the most common form of dementia. It generally occurs after the age of 40. We are seeing more and more cases of early onset Alzheimer's. It is more common in women than in men, and the cause is thought to be some kind of defect on chromosomes 19 and 21, albeit they don't know what the true cause is. Most of the time, what you're going to see are pathological alterations in the brain, basically with the formation of amyloid plaques and myofibril or neurofibril tangles. If you look here, you can see these dark spots. These are those amyloid plaques. If you look at the normal brain tissue, it's very clear. Here you can see big gaps in the brain tissue that we don't see in the normal brain tissue. And this is because of all of those tangled up pieces of neural tissue. Clinical manifestations of Alzheimer's disease are general forgetfulness, usually with short-term memory. Long-term memory is another part of the brain, and so that part of the brain usually isn't interfered with until much later with the progression of Alzheimer's disease. Emotional upset, confusion, as well as loss of concentration and disorientation. A lot of times you'll see what they call silver alerts. They have them up on the signs on the highways. We see them a lot of times in Facebook or other social media, where you've had somebody that has left their home or the facility that they live in, and they are lost because they don't have any ability to discern where they are or anything like that. And that's one of the major manifestations that you see with Alzheimer's disease. One of the things that you also see is some changes in mental status, particularly behavioral changes. A lot of times you'll see some issues with aggression, irritability, as well as generalized restlessness and agitation. The diagnosis, there really is no test, if you will, to diagnose Alzheimer's disease. The major diagnosis is by ruling out all other types of dementia-related neurological pathologies. The clinical criteria is developed to assist with that diagnosis, which essentially is looking at what are your symptoms and how can we rule out other things. Family history is going to be used to assess any kind of progression of the disease, how fast or how slowly did it progress in your loved ones. Parkinson's disease is a disorder of movement. This is generally going to begin after the age of 40, and as we increase towards the age of 60, the incidence increases with age. It is more prevalent in males than in females, and its known cause is, or its primary cause is unknown. Several genes have been identified as having mutations that will lead to contributing factors to Parkinson's disease, but as of yet, there is no known cause. Parkinson's disease is essentially a degenerative disease of a part of the brain called the basal ganglia. We also have the loss of dopamine-producing neurons that are prevalent in that part of the brain. The resulting depletion of dopamine and the access to cholinergic receptors is going to cause the progression of the symptoms that we see with Parkinson's disease. If we look over here at the picture, we'll see that we have our receptor cells and we have our transmitting neuron here, and they are releasing that dopamine. That dopamine binds to the receptors, moves into the cell, and does what dopamine does. Dopamine does a number of different things, and in Parkinson's disease, this is the chemical that essentially alleviates any kind of unneeded movement. It's also that chemical that makes us happy, and so again, it has an issue with the symptomology of depression for people with Parkinson's disease. If we look over here at a Parkinson's patient, we have the lack of dopamine or eventually the lack of receptors. So either way, whether it's the receptor cell not having the dopamine receptors, or the transmitting neuron releasing dopamine, we have a defect in the amount of dopamine that's moving towards the postsynaptic neuron, and we end up then with the symptoms of Parkinson's disease. Dementia can develop over time due to plaque formation on the brain. It is not one of the very first symptoms that we're going to see. This is going to be one that is going to occur as Parkinson's disease progresses long term. The clinical symptoms are going to be tremor at rest, excuse me, muscle rigidity, bradykinesis or akinesis. This is going to be bradykinesis is going to be slow voluntary movement. Akinesis is non-existent voluntary movement, where the patient is no longer able to voluntarily control their skeletal muscle. Postural disturbances, a lot of times patients with Parkinson's disease will have either a very rigid posture or a very slumping posture. Some will have difficulty speaking, which is what we call dysarthria, and some will also have difficulty swallowing, which is called dysphagia. Treatment and diagnosis are going to be based on history and physical exam. There isn't any real specific test for Parkinson's, much like Alzheimer's disease, but we can use a PET scan to assess activity of the function of the brain where movement takes place. So when we're looking at those parts of the brain, if they are not looking normal, then this can give us an idea about our patient and the probability of Alzheimer's disease. Drug therapy is going to be used to decrease Parkinsonian symptoms. These drugs are going to include some kind of dopamine agonist, which means that these are artificial dopamines like L-Dopa or something like that. Antidepressants, MOAI, monoamine oxidase inhibitors, serotonin reuptake inhibitors. These are going to help with the lack of dopamine and helping with mood. And then anti-tremor medications to modulate any kind of tremor that the patient may have. Huntington's disease is a genetic disorder. It's a relatively rare disorder, but it is an autosomal dominant trait, meaning that there is a 50% probability of inheriting to this disease. If it is one of the chromosomes, if it's on the chromosome that you have, you will express the disease. It is on chromosome number 4, so they do know exactly how Huntington's disease is caused. It's characterized by what we call degenerative hyperkinetic movement, or abnormally excessive involuntary movement, movements that you can't control. The onset is generally at a much younger age, usually between the ages of 25 and 45 years of age. You'll see people with the onset of Huntington's disease being very young. One of the things about Huntington's disease is a lot of times if you've had on the later onset on the later side where you're 40, 45, 50 years old, most of the time you've had your children by then. People that are much younger are opting not to have children so that they're not passing this on into the family line any farther. The pathology is basically degeneration of that basal ganglia again, but instead of dopamine, we have a depletion of a neurotransmitter called gamma aminobutyric acid, or GABA, and this is the biochemical neurotransmitter that alters the integration of our motor and mental function. So when this gets broken down, we begin to have changes in motor function, we have changes in mental acuity, and those are going to be the things that we will see as our beginning symptomology for Huntington's disease. The symptoms are going to progress rather slowly. They're going to include that involuntary movement. We have 3 different kinds of movement. We have Huntington's disease with what they call chorea movement, which is irregular, uncontrolled, and excessive movement. This usually begins in the face, the hands, and the feet, and then will begin moving its way through the rest of the body. This is the most common type of movement with Huntington's disease. You do have athletosis, which is kind of a writhing movement. This looks a lot like the movement that you see with people with cerebral palsy. Huntington's Ballism, this is a kind of repetitive, constantly varying movement where you have a lot of large movements of the the limbs, kind of a flailing or flinging movement of the arms and the legs. This does lead to some progressive dysfunction of the intellect. This can occur as the disease progresses and will eventually lead to initial issues of dementia. Cognitive deficits can be things like loss of your working memory, being able to plan or organize or even sequence, knowing, okay, I have to take a shower. So that means that I have to turn the water on. I have to take my clothes off. I have to shower. I have to turn the water off. I have to towel and get dressed. That would be, they would not be able to do that. They may get in the shower with their clothes on, or they may take their towel in and dry off with the water still running. So these kinds of ability to organize, plan, and sequence will become lost over time. Treatment diagnosis is based on family history and the clinical presentation, and obviously genetic testing. You can always test to see if that chromosome is defective. As of now, there is no treatment, the only management of symptoms as long as the symptoms are manageable. That's the end of Alzheimer's, Parkinson's, and Huntington's disease. Please send me any questions that you have, and I'll get back with you as quickly as I can.